and welcome to On Point. I'm Ramirez. More students now than ever before are searching for mental health services through their universities. But students who suffer from anxiety, depression, and other mental health problems may have to wait a couple of weeks just to be seen and often struggle to find affordable treatment off campus. The American Psychological Association says about 42% of college students struggle with anxiety and 36% suffer from depression. Some CSUN students say it can be difficult and expensive to get help.
I think if you feel like you're having some sort of issue that you feel like you can't express to people you know, I think it's good to have somebody outside of your network to speak to.
I think a lot of students have a hard time coming to their parents regarding this issue, and one thing I really like is that CSUN offers counseling for us, which I really like because it can get expensive, and for some people they can't afford it and they really need to find people to talk to.
At CSUN, I believe it's pretty affordable. I do go to the counseling services here on campus, and the only thing I've had to pay for is for my medication, and so far it's only been like $7, and it's usually lasts me a pretty good while, so I would say pretty good.
It needs to definitely be easier, a little more accessible. It's not prioritized in this country.
According to the Anxiety and Depression Association of America, 37% of Americans seek counseling treatments. The California Faculty Association recommends one counselor for every 1,500 students, but the CSU has a system-wide ratio of 2,500 students to one counselor. On Point's Manny Luissi has more on the story.
Thank you, Lily. Our guests today are Miss Amani Williams, Associate Marriage and Family Therapist, and Dr. Megan McDonald, Clinical Director of ACT Health and Wellness. We'll start first question with Dr. McDonald. Dr. McDonald, would you say there are problems in the process of obtaining a therapist?
I think there can be sometimes, and unfortunately I think it scares some people off. I think one of the problems is people don't know where to start. And so a great place to start is the campus clinical center or counseling center, and they can help direct people to get a therapist. But I think that's one of the most daunting things about starting therapy is trying to find somebody.
Anything you would like to add, Ms. Williams?
I completely agree. I think now, thankfully, there are a lot of resources online, and I think social media can actually be a really great resource, at least as where to start and finding a direction. There's a lot of actually great Facebook groups that will post where people have started on their own and websites and where to find a therapist. So it can be challenging, but there's more now where we can find things that we need.
Our next question for Dr. McDonald, would you say therapists are affordable?
That is a great question. I think it depends on where you're looking and what resources you have. A therapist can definitely be affordable. Money should never be a barrier to getting help or to getting any mental health treatment. So there's definitely resources available no matter what your income is.
Ms. Williams, anything to add?
No, that was it.
This next question will be for Dr. McDonald. What would you say therapy should typically cost? And could you tell me about the sliding scale?
Sure, that's a great question. Therapy can cost from nothing. I've seen people charge up to $400 an hour. I know that in my practice, my private practice, I charge a lot less than most of my colleagues do because, as I say, I don't think I don't think money should be a barrier to mental health accessibility. But there's so many resources for those people who don't have insurance or who don't have a lot of money. For instance, our clinic, we take Medi-Cal, and we have zero copay. We don't take any money. So on average, I would say if you're paying out of pocket, it could be anywhere from $150 to $200 an hour. A sliding scale, usually therapists in private practice or group practices have a sliding scale depending on your income. And so they'll reserve a few slots for lower than their normal hourly rate in order to help people who aren't able to pay full fee, and usually people have a few slots for sliding scale.
This next question will be for you, Ms. Williams.
Okay.
Is there any truth to the idea that there may not be enough therapists for the amount of patients seeking therapy?
Wow, that's a great question too. I think it depends. I feel like, especially in our field and where we work specifically, it can definitely get to a point where it feels like there's not enough of us. And I think in the broad scheme of things, we're definitely growing our bandwidth of being more available, and more therapists coming out of school and more people going into the field. But I guess on a smaller scale, even just looking at where we work, it can definitely get hard to see everyone at the same time and try to be effective still.
Any ideas on this, Dr. McDonald?
I think what Amani said is true, and I think that there's definitely availability out there. I think it's a matter of tracking the right people down and tracking people down within your resources.
The next question will be for both of you, and I'll start with you,
Okay.
Ms. Williams. What is the best way to go about getting a therapist?
That's hard because I can't say that there's only one best way. I think when we're kind of like what Dr. Megan said, especially here at CSUN, going to the counseling center, I think is a great start on a university level. And sometimes word of mouth, if a friend is already in therapy and things are going great for them, maybe being referred by a friend or looking into insurance if you have it. Again, social media can be helpful. Places like Psychology Today can at least help you kind of filter exactly what you're looking for. But I can't say there's one number one way, but those are a few I can think of.
I will rephrase the question for you, Dr. McDonald. From students we surveyed, a lot of them believe that you have to speak to your primary doctor. Is that something that is valid, or?
No, you never need a referral to go for mental health treatment. And you can, if you have insurance, you can definitely contact your insurance provider, and they will give you a list of therapists in your area. And sometimes it is a lot of work calling around and asking, do they have openings? What's their fee schedule? Things like that. But you never need a referral for mental health.
This question will go for both of you as well. Okay. Ms. Williams, what are your thoughts on why mental health treatment is perceived differently from other types of healthcare?
Well, I think one of the reasons is because I think as a whole we still haven't seen it as connected or as necessary as physical health. I was having a discussion with Dr. Megan about that, how we go to the doctor when we have aches and pains and bumps and bruises, but we don't see it the same with mental health, and we have the same more invisible aches and pains that deserve to be treated. And our mental health is so connected to our physical health, and so until we see that as a whole, I won't say always, but it will continue to seem separate until we start to see it as connected.
Anything you would like to add, Dr. McDonald?
I think that, somebody has pneumonia, if somebody has a broken bone, we can look at an x-ray, we can look at an MRI, we can see it. And unfortunately with mental health, it's a lot more difficult to see. Amani and I can look at somebody with their presenting symptoms and we can say, okay, this is the problem, this is what's going on. But it's a lot more difficult, and therefore I think it's a lot harder for other people. If somebody walked in to a family gathering with a broken bone, everybody would say, oh my goodness, you need to go to the doctor. But if somebody walks in and is feeling very depressed, the main thing people are going to say is, oh, you need a good night's sleep, you need to exercise, you need a good meal. So I think because the symptoms are different and there's no visible sign that the average person can see, It just makes it, people tend to dismiss it a lot quicker, which is really unfortunate.
The next question will be for you, Dr. McDonald. Could you touch on the topic of medication and why it seems doctors will prescribe this before recommending therapy?
Gosh, that is a really great point to bring up. So I'm a psychologist. I'm not a psychiatrist. A psychiatrist is one that can prescribe meds. I think a lot of times, I think medication is so important. I think that medication in conjunction with therapy is just the perfect route to go down. I think that sometimes doctors are quicker to prescribe medication. For instance, if someone's sick, they're quick to prescribe antibiotics or something like that. I think it's a great, I think it's sort of, someone is sick, you give medication. And I think medication's very important. So I think it's fine. I think it's in conjunction with therapy, it's much better.
We would move on to the topic of insurance. This question will go for both of you. We'll start with you, Dr. McDonald. Insurance companies could implement limits on mental health visits. What are your thoughts on that?
Well, they're not really supposed to. About 10 to 15 years ago, they introduced parity laws, and parity means they're going to treat certain mental health diagnoses the same as they do medical diagnoses. So for instance, if someone needed dialysis, the insurance companies are not going to limit the amount of dialysis they need. They're not going to say you can have 30 dialysis visits a year. So insurance companies really are not supposed to limit the amount of mental health visits. And again, like Amani said, until we start recognizing that the mind and body are connected, we're not going to be able to fix a person as a whole if we're limiting. Again, if somebody says you can only have 30 chemotherapy visits to cure your cancer, well, that's not how it works. It's going to take as long as it takes. And so, again, insurance companies really aren't supposed to be limiting the number of sessions. But unfortunately, a lot of people don't know that.
Any thoughts on that, Ms. Williams?
Well, just to add also, I think what insurance companies don't realize is the process of therapy. So things are not always a quick fix. And I mean, even just getting to know a therapist and building rapport and trust in a safe space can take a lot of time before you even get to the root of whatever's going on. And I don't think insurance companies realize that it is a process and it takes time, and there's a lot of patience that we hold and trust that has to be built, and it can take longer than 8 sessions or 20 sessions, and that can be where it starts to get to why the person is there in the first place. So it's unfortunate that there are limits, because there's so much more to therapy that happens and needs to happen.
This next question would be for you, Dr. McDonald. Would you know what doctors are looking for when assessing someone's mental health?
Sure. I mean, primarily we start with safety. We start with a safety check. Are they safe? Are they a danger to themselves? Are they a danger around anybody else? Are they gravely disabled, which means they can't care for their food, clothing, or shelter because of their mental illness? And then we start going into symptoms. What brought them in today? What prompted them to make the appointment? What is going on in that space and time that they felt that they wanted to reach out and ask for help? So we start looking at what's going on in the daily life, and then we start, when did this start? When did your symptoms start? How bad are they? Tell me what it feels like. And just kind of go from there.
This next question is for both of you. We'll start with you, Ms. Williams.
Okay.
How do you feel about the accessibility of therapy today, and what do you think we could expect in the future?
Well, I think today we are becoming much more available. I mean, there's things now like telehealth where you can do video sessions, you can do like texting and email, and of course you can still do the face-to-face. So I think there are more options now, which I think is great. And I think that in the future it will become more accessible because I think we're really trying to normalize therapy. I mean, I'm seeing it more in TV shows and all kinds of places in media where people are just either admitting that they're going to therapy or just making it normal and making it okay and validating that we need that like emotional first aid kit just like we need a physical first aid kit. And so I think that we're moving in the right direction. We're not there yet, but I think we're getting there compared to maybe even 10 years ago.
Dr. McDonald, any thoughts?
No, I completely agree. I think it's becoming a lot more accessible. I think, teletherapy, telehealth is getting a lot more common. And I think that can be a good thing when used appropriately and ethically. And I think that it is becoming a lot more destigmatized than it has been in the past, which is amazing.
This is all we have time for. I would like to thank our guest. We'll be right back.
Thank you.
Thank you.
Welcome back. Joining us now is Steve Silver, staff psychologist at CSUN's University Counseling Services and alcohol and drug counselor. Dr. Silver, could you tell me about the accessibility here on campus?
Sure.
So mental health services.
Yeah, sure. So we're located up in Baramian Hall. I think we're Suite 520, and our services are available to all CSUN students. There are no added costs to our services. So essentially, any student can schedule an intake appointment, which is basically 45 minutes talking to one of us. There's about 18 to 20 of us on staff, depending on what time of year, and someone will just meet with us, talk about what their concerns are, what goals they would have for therapy, what's been causing some of their distress. We help them explore that a little bit, and then we come up with a game plan of support for them. So that can look a number of different ways. We might meet with them for brief individual therapy. We are a brief counseling center, so if someone's seen for individual therapy, there's no hard number, but I'd say the average is maybe 5 sessions, give or take a few. If someone is wanting or we feel like they might benefit for more ongoing therapy, although we wish we could do that because we love doing therapy, obviously, in those cases we get them linked up off campus or at other locations on campus so they can get that more ongoing support, develop that trusting therapeutic relationship with someone. And then regardless of whether someone is being seen by us or elsewhere, we have crisis walk-in services. So whenever we're open, any student who's in crisis, whether they've ever reached out to us or not, can walk into our center and say, I'm having suicidal thoughts and they're intensifying, or I'm having a panic attack, or whatever urgency it might be, and we all rotate to be available to meet with them for a brief session, make sure they're safe, and come up with a game plan. And then after hours, if someone calls our main phone number, it'll direct them to press option 3 to get in touch with a live crisis counselor. And so that covers 24 hours a day, 7 days a week, that students have that type of support. We also have a lot of groups and workshops, and after that first appointment that someone has, they might even start off with a group or workshop a lot of the time just to start developing some coping skills. So in terms of accessibility, very accessible. That's the short part of the answer. And really the first step is just reaching out to us, and that's what part of our job is to just listen to someone's concerns and come up with a game plan that feels comfortable for that student.
Would you know if there are similar services at other colleges?
Generally, I would say that most college campuses have some sort of counseling center. I think it's becoming more evident that there's a need for it on college campuses, and the sizes vary. I've worked on other campuses that have slightly smaller staffs. There are campuses that have 60 staff members, but I can't for sure say all college campuses have it, but for the most part, I would say they do, which is a great thing because students definitely need that sort of support.
Why would you say therapy should be important to students?
Sure. Yeah, I mean, I think well-being is important, you know, especially when we think of our role being on a college campus and trying to support students to reach their academic and their career goals. If someone is struggling relationally, personally, emotionally, psychologically, it's bound to impact their ability to get through college. And so, yeah, we all thrive on supporting students and being able to be part of their journey. And so I would, you know, I know there are a lot of ideas out there about therapy, but we encourage students to give it a shot if they're feeling like they need support. And just because they reach out once doesn't mean that they're going to have to, you know, come consistently. People sometimes decide, you know what, maybe it's not for me, but you don't know until you try. And if you're in distress, you know, why not give it a shot?
Could you touch on the topic of medication and why doctors could prefer this treatment over therapy?
Well, I can't speak specifically to medication. So I'm a psychologist, not a psychiatrist, but we actually do have a few part-time psychiatrists at our center. More so for students who don't have insurance or who just have Medi-Cal. If someone has private insurance, we'll support them in getting linked up through their insurance. I'm not quite sure how to speak to the point about doctors preferring medication over therapy. I mean, some of the research says that if medication is indicated to help someone with their emotional or psychological needs, that a combination of talk therapy and medication, if it's indicated, is most beneficial. So if we're meeting with someone for a first-time appointment and they're seeking those services, or if we've been meeting with someone and that becomes part of the conversation that they might want to just have a consultation with a psychiatrist to have medication potentially supplement their talk therapy, then we might go that direction. But yeah, it's more so the psychiatrist who would recommend or not recommend a medication.
What would you say to students that self-medicate to deal with their problems?
And by self-medicate, do you mean
alcohol, drugs?
So it's substances?
Yeah.
Sure. And the question is, what would I say to them?
What would be some advice to those students?
Sure. I mean, it's a tricky one, right? Because sometimes in the short run, it can be helpful for some students. Sometimes they forget about the risks associated with them, or in the short run, smoking weed, for example, may help someone with their anxiety temporarily, but then over time it might start to affect them differently. Some people use and it actually induces some anxiety. It's a very subjective experience of smoking. And so in terms of self-medicating, that is a tricky one because some people might not know or be conscious that they're self-medicating. They might just be enjoying themselves and connecting with people based on substance use, but then it might kind of slip into that territory. So, I mean, I would say if someone starts to notice that they're spending a lot of time thinking about or using a substance, or other consequences start showing up, people that they're in relationships with, friends, family, romantic or sexual relationships, people start to pull back from them because of their substance use, if they're not meeting responsibilities because of their substance use, not going to classes, stuff like that, then it might be an opportunity to take a look at their use if it's been increasing. And a first step might just be calling our center and saying, hey, can I schedule a first appointment? Students are welcome to ask to be referred to Dr. Silver, and I'll meet with them for a first-time appointment. If they don't remember my name, and I tell everyone this, they can call our center and say, can I talk to the drug guy? And they'll be put through to me. So they don't even have to know my name, but that's part of my role there. I do general therapy as well, but yeah, I just say it can't hurt. It's private, right? So aside from some safety-related things in terms of if someone is at serious risk of acting on suicidal thoughts or homicidal thoughts, or we hear about abuse going on, those are the only things that potentially wouldn't be private. Everything else, including substance use, I am legally bound by confidentiality laws as a psychologist. So once people realize that, sometimes there's an increased comfort in talking about what might be going on with their substance use, and then we can come up with a game plan together.
How do you feel about the accessibility of therapy today, and what do you think we could expect in the future?
I mean, I think it's becoming more accessible. I think destigmatization is part of that. I think it's great that that some of the stigma that's out there in terms of what's gone on in the field in the past and ideas about crazy people, which we're moving away from that. And I think people are seeing therapy more for what it is, which is the ability to get support from a caring individual who is trained to support people, but is also a human who helps kind of connect with people on a human level, and that's helpful. I think along with that comes the other side of that coin, which is resources, and we're always wanting more resources for our students, and our center specifically has gotten pretty creative with how we're trying our best to meet student needs. The combination of individual therapy, because we're limited in terms of having brief individual therapy, we just have a thriving group and workshop program. We have, I think, maybe 17 or 18 groups and workshops, and research shows that they're about equal in terms of effectiveness, and people can actually connect with each other. So I think in terms of, the word that's coming to my mind is grounded. Like, people are experiencing therapy as a more grounded thing, as opposed to this, I'm not sure what adjective to use, but this mysterious thing that happens behind closed doors. And we all at our center try to be grounded individuals and try to be relatable. And we feel like we're pretty successful at that. Yeah, but every place can always use more staff, and we have a desire to support people as best we can. So
I would like to thank our guests for joining us.
Sure.
Did you make the transfer to Hong Kong for the Emerson project?
I was just about to, but did you see the boss's email? It doesn't look right.
It looked fine to me.
I don't remember him mentioning the Emerson project at our last meeting.
The bank in Hong Kong closes in 15 minutes. Make the transfer.
Yes, sir. It's on the way.
Mr. Jacobs, just transferred the money for the Emerson project.
What Emerson project?
Don't be that guy. Trust but verify.
Thank you for watching On Point. You can follow us on social media at CSUN On Point. You can hear us on KCSN 88.5 FM on Sunday mornings at 5:30. You can watch us on Santa Clarita Valley Television on Sundays at 11 and 5, and on LA 36 at 4 o'clock on Thursday afternoon. For all of us here on Point, I'm Liliana Ramirez.